Jim?
Yep. Try and get a bit of the background there, say something like that.
Okay.
You can zoom in a little bit if you want.
Okay.
Better in portrait mode.
Hello everybody, my name is Dr. Edmeads. Nice to have you with us today. We're here today in City Dental with Dr. Joseph Klar, who's been the foundation of this business for many, many years, and I'm going to ask him a few questions that will give you a little bit of an insight of where this practice has come from. So Joe, thanks for coming. How long have you been with City Dental, would you say, and what does your time mean to you?
Well, I've been with City Dental since 1975 after returning from London, where I spent about 3 years, and the practice was located at 61 Market Street, which is the corner of Market Street and Pitt Street, and we're on the third floor in an older building, and we were there for 10 years with Dr. Miskovich, and he was an elderly gentleman, about 10, 15 years older than me, and you know, a young pipsqueak came from London, you know, he was wondering what I'm up to with all these modern ideas, what I'm going to do. And then we were there for 10 years, and then we moved across to this present location at 44 Market Street.
That was in 86?
85.
85.
We moved across, yeah.
85. So obviously it's had a massively long history, this whole practice. Pre-you, you've had it now for over 30 years. What do you think has been the main driving force behind having such a loyal patient base that goes for so long?
Look, we were very patient orientated, and we presented a picture, and that we really care for the patient, and we actually, you know, all of our treatment was based around the concept that patient's priority is number one. We would only recommend treatment that we would do on ourselves or our families. And this came across to patients, and we got referral after referral, and we built quite a large practice as a result.
Yes, it's very evident to me. And look, perhaps an obvious question, but some people will be asking, well, why are you retiring, and what are your plans in retirement?
Well, look, I can keep going for at least another 25, 30 years without a problem at all. But everyone has a use-by date, I guess, and you have to have an exit strategy. So whether it's in the next 12 months or a few, 2 years' time, we all have an end point, and we have to try and aim and have a plan towards that exit strategy.
And obviously you've employed a number of dentists over a number of years. You've got a team here that you've built up yourself. Now I'm the new addition to this. Would you mind sharing with the audience perhaps what you think I might bring to the practice that's a little different to most dentists?
Well, look, we all have different backgrounds and we have different interests within the dental sphere. I believe your interest and your contribution to the practice will be your surgical background and your implant background. So you've had considerable training overseas in this field, and I think you could contribute a great deal to the future success of this practice.
And what gives you confidence in handing over patients to us, younger dentists coming in behind?
Well, I guess I could say I don't have a choice, right, because I'm getting older. However, look, all the people around me I have interviewed, I've worked with them for some time, and I have full confidence in them and their ability to carry out the work that's required.
And if you could say there's 3 things you could say to, 3 reasons you could give to patients to continue coming to City Dental when you leave the mantle, what would they be?
Look, our approach still remains the same. We are patient-orientated and care-orientated. Secondly, there's continuity, because we still have all their records, which goes way, way back. So it's not as though they're being abandoned. It's basically a continuation of past treatment. And thirdly, all of our team is highly competent. They are experts in their field.
And are there any personal clinical attributes you could that come to mind when you think of the clinicians working with you here?
Look, I think they're all very competent, as I said, in their own field, and we all have different interests in dentistry. Yours is surgical, mine was largely based on orthodontics in latter years, and Jack is very interested in technology and scanners and 3D technology, which is really good. And Dr. Katerina is also training in orthodontics, and she's very caring, and so it's really a great future if all this goes ahead. And EJ, Dr. EJ, is also great in what she does, very competent dentist.
And I suppose you've been in my shoes before, and I'm curious to see what was your experience when you first took over this practice 30 plus years ago, and did you find that patients were a little bit hesitant to come over to you? What were the sort of challenges? And
well, look, it was a bit daunting initially. In a way, being a young dentist back from London, I had no experience in running a practice, so I was thrown in at the deep end virtually. So I basically had to take over the whole practice, and I basically bought the practice with Dr. Miskovich in it. So basically I bought him as well.
Right.
And function leads to experience. So you make a few mistakes, hopefully not too serious, and then eventually you succeed and you keep going.
And what were the patients like back then? Did they accept you straight away, or did it take a bit of time?
Look, some did, some don't. We all have our own following. You have a different type of person following you than me. We each do. We attract different people to us. But the great benefit that what you've got now is you have a mixture. So you're going to attract a greater circle of people to the practice.
And obviously, back in the day, you were an early adopter of technology, and obviously we're continuing that tradition now with introduction of a lot of 3D technology and coding CTs and root planning orthodontics and dentofacial orthodontics and stuff. Is that something that you did a lot of in your time as well? You found paid off as well, or not so much?
I think that getting into airway dentistry, dentofacial orthopedics was very, very beneficial to my success, if you want to call it that. You develop a tremendous understanding of all fields of dentistry because it envelops other fields of dentistry as well. So you have a totally different approach to treatment of patients. So it's an all-encompassing approach.
Yeah, so it's sort of looking at a holistic approach to dental
Holistic
care.
approach.
You're not looking at one tooth as one problem and ignore the whole.
You basically approach it with a view that you don't want to treat a symptom. You basically, that's why you're a clinician or a technician. That's the difference between the two people. A technician finds a mechanical means of fixing up a problem, whereas a clinician works out, well, what went wrong and how can I avoid this happening again? So our job as clinicians is to work out the cause of each problem and try and avoid it recurring again.
Yes. Well, we're very excited going forward. Our patients will be getting more in-depth cancer screening with the Veloscope. We'll be using the SciCat software from Sirona to look at airways and all that sort of stuff. So I think it's going to be a great collaboration. Do you have, as a sort of finishing message to your patients who might be anxious about you cutting back on your days, any last messages to go out today?
Look, the message to the patients is that I'm phasing out gradually, and I'm gradually handing over the reins to you and the other dentists, and I have full confidence in their ability to treat them at least as well as they have been treated in the past, perhaps with newer technology, so things should only improve even greatly. Some of the elderly patients may not appreciate that as much as some of the younger patients, but that's just the nature of human beings.
Great. Well, I'd like to thank you very much for your time and sharing your thoughts with us today. And well, we'll keep in touch with everybody.
We'll keep in touch. Thank you very much.
Good. Well, let's send it off. See what happens.
Let's see what happens.
See what happens.
How
I'm
do
sure they'll
I
have sedations.
stop it there? No.
I think.
Well, that's sort of covered.